On the first day of their life, soon after birth, all babies should have a thorough examination to check for any visible signs of jaundice. These should be done in a white light or daylight. Before you start, follow the hand washing protocol. Make sure that you press the baby's nose, look inside the mouth and check the conjunctiva. Any visible sign of jaundice on the first day should trigger phototherapy treatment for all babies. If available, babies with any sign of jaundice on the first day should also have a blood test to check the levels of bilirubin in their blood.
This blood test, called a serum bilirubin measurement, is the best and most accurate way of measuring the bilirubin levels and the severity of the bilirubin. However, it does require a laboratory which can produce a quick result that you can act upon.
Bilirubin measurements can be expressed in two different ways, either milligrams per deciliter or micromoles per liter. If you have access to timely laboratory bilirubin measurement, this is the gold standard for deciding treatments for jaundice, whether to use phototherapy or refer the baby for an exchange transfusion. Treatment decisions depend on how many days old the baby is and whether the baby is full-term and healthy, or whether it's premature, low birth weight, or sick. So, on day 1 of life, all babies with any signs of jaundice start phototherapy. But they also need a laboratory bilirubin measurement to check if further treatment is needed. If, on the first day of life, a healthy term baby has bilirubin levels above 15 milligrams per deciliter or 260 micromoles per liter, then phototherapy may not be sufficient. The baby needs urgent referral for a decision about a possible exchange transfusion. For premature babies or babies with a low birth weight, this is slightly different. They need urgent referral with bilirubin levels above 10 milligrams per deciliter or 170 micromoles per liter. On the second day of life, phototherapy should start for a healthy full-term baby if their bilirubin measurement is 15 milligrams per deciliter or more. Once again, for premature and low birth weight babies, the threshold is lower. Referral for a possible exchange transfusion will be triggered above 25 milligrams per deciliter for a term baby and 15 milligrams per deciliter for a premature, low birth weight, or sick baby. On the third day of life, the bilirubin levels required for treatment go up again. And on the fourth day onwards, they are higher still. These are now the thresholds that should be used to treat any baby more than 4 days old.
If laboratory tests are not available or are likely to take too long, there are other ways to estimate bilirubin levels. One of these is the transcutaneous bilirubin measurement.
This requires a small machine which works by shining a light onto the skin to estimate bilirubin levels. However, it is not as accurate as a laboratory test. If you do not have access to a laboratory to get timely results, or a machine to measure transcutaneous bilirubin, then you can estimate bilirubin levels using the Kramer's scale and use this to make treatment decisions. Kramer's scale works on the principle that jaundice tends to spread over a period of days as the levels of bilirubin in the blood increase. It starts at the head, and then as bilirubin increases, it spreads to become visible on the upper body, then on the lower body, below the umbilicus, then on limbs, and finally on the hands and feet. So one can estimate bilirubin levels depending on how far the jaundice has spread. So, if the jaundice is only visible on the head, it is likely to be equivalent to between 4 and 6 milligrams per deciliter of bilirubin in the blood. If it is in areas 1 and 2, then the estimate is for between 8 and 10 milligrams per deciliter, and so on. Once it is visible in the palms of the hands and soles of the feet, then it is likely to be between 15 and 20 milligrams per deciliter or higher.
Remember that these are only estimates, and they become much less accurate when there are high levels of bilirubin in the blood and the jaundice is visible in the hands and in the feet. So Kramer's scale is not very good for judging whether a baby needs to be referred for an exchange transfusion.
However, if a blood test is not available, Kramer's scale is very helpful for deciding if a baby needs phototherapy. So, if you see jaundice only on the head of a baby, these will only trigger phototherapy if the baby is in the first day of life. If after the first day you see jaundice on areas 1 and 2, you will start phototherapy if the baby is premature, low birth weight, or sick. But you would not if the baby is full term and healthy. If the jaundice has spread any further and is below the umbilicus, then all babies with these symptoms need phototherapy, whether they are full term or premature.
Finally, you need to do your examination and make a clinical decision before you start phototherapy. After phototherapy has started, this will change the baby's appearance, and any estimates that you make after that are likely to be less accurate.